It is 2 o'clock. This is Steve Marzoff. I'm the Integrated Services Program Director for VITA, and moderating today's webinar. We sometimes like to do webinars that are outside our normal subject matters of GIS and 911 and public safety and things like that. And this was one that came about as an idea that we want to make sure that people understand all the services that are available out there. And there are 2 programs that we're going to talk about today, CommonHealth and the Employee Assistance Program, or EAP. So we have 2 presenters today. First will be Craig Hicken, who's one of 9 CommonHealth Regional Coordinators for the Employee Wellness Program. He's been with CommonHealth for 10 years and currently handles the Petersburg and South Central region. Has 20 years experience in fitness and wellness industry as a registered nurse and a certified fitness trainer, and he'll be talking about the CommonHealth program. And then the second portion of the webinar today, we have Lynn Vogel, who is an account management executive. She's served as a dedicated behavioral health and employee assistance program resource for the Commonwealth of Virginia account since April of 2013. This account includes state employee health plans available through Anthem, as well as healthcare options available to local government and schools through the Local Choice program. Lynn has an extensive background in behavioral health, EAP, and government programs industry, with her most recent experience being supporting Anthem's Medicaid product and managing the provider network and customer service team for Virginia's behavioral health program. So obviously we have 2 well-respected experts here. And again, we want to provide this opportunity for everybody to understand what these programs are, and these webinars are for you. So if you have questions as they go through their presentation and you want to interrupt with a question, please do. We'll also have opportunity for questions after each one of them, and then at the end as well if there's any questions that come up. But we really want this to be beneficial to you, and so that you understand what these programs are, what they can do for you, how they can help, as you go through your day-to-day lives. So with that, please remember again to mute your phones so we reduce the background noise. Again, we want to keep them with the ability that we don't want to force mute them, so that you have the ability to ask questions as they come up as we go through it. And again, please do not put us on hold so we don't get the background music. And with that, Craig, I will turn it over to you as our first presenter.
All right. Thanks very much, and good afternoon, everyone. It's a pleasure to be here today. We're going to be speaking about our wellness program, and I guess we're speaking to both Commonwealth employees as well as local choice employees, which we typically don't actually see these 2 groups together, so I'm going to kind of give you the highlights of what we do for each program as we go through. So our first slide, as you'll see, is our local choice. If you were to go to our website, there'd be 2 tabs. One would say local choice, and the other one would say COVA, Virginia, and you would just click on either one, and then you'd enter your specific area of our website. But we see here is that CommonHealth is an employee wellness program. On the local choice side, all employees that are participating in the health benefits program are eligible. So if you have signed up for health insurance with your group, then you'd be eligible to participate in our programs. And that's a little different from the state side, where everyone who is eligible for benefits is eligible for CommonHealth as well. So it's a little bit different there. You can see our website, commonhealth.virginia.gov, and that's where you would go. And I usually mention this to people because you don't necessarily have to come see a live program to get the benefits of CommonHealth, we try to use our website as a great resource for everyone. And I'll tell you a little secret: you don't even have to be live in the state of Virginia to actually go on our website. There's no restrictions on it. You don't need a password, the username. You don't have to set up an account. You can just go and look, which is kind of rare these days. But we just want to put that information out there for anyone, and you're free to go check that out whenever you'd like. We're, as you can see, a program through the Department of Human Resources. So we are actually all state employees. We didn't start out that way. CommonHealth originally started in 1986, so we've been doing this for a really long time. But we only came under actually the state's umbrella about 10 years ago. So before that, it was a private company. So let's move forward here. And a lot of people think of health and wellness. It's kind of scary to them. People tell them how to live their lives, and we are kind of understanding of that. So we always, when we come out to see you and share information, we try to put you at ease and let you know that we're just trying to help you live a better life and a healthier life. So what do? We do lots of different things. One of the biggest, I guess, would be our health education campaigns. And when I say when we come out to see you, you are eligible for us on the local choice side to come out once a year, on the state side to come out twice a year. Here's a couple of our recent programs that we put together. And when I say put together, we consist of a team of about 9 people. We work out of our home office, so we live all over the state. Depending on where we live is the area of the state that we cover. So we'll get together periodically and produce upcoming campaigns, wellness campaigns. This one, think about it, as you can see, is about brain health, which is important, obviously, to everyone. And the second one is what we're currently talking about, which is metabolism makeover. And we've come to find out that weight control, weight loss, metabolism, pretty interesting topic for most people. So we put together a great program to kind of give you some tips about how to improve your metabolism. What I'm going to do after we go through some introductory slides is actually get into the metabolism makeover program a little bit, just to give you an idea of what a program would be like if we came out and presented it to your agency. Okay. So when we do present, there's different ways. The first question lots of agencies have is, what's the program like? How long does it take? If we schedule it, how long would you need? And we try to make this as flexible as possible because every agency is certainly different. Some we're talking 24-hour agencies. We've got agencies that in corrections where they really can't get together in a meeting setting very often. There's call centers, so we have to kind of come up with different ideas to present this information. And what we like to think that these 4 options here kind of can cover every type of agency. The first one's just traditional presentation. So we would come out, we'd agree on a time and a date, and we would just present whatever program topic we're talking about verbally to a group of people. Could be, we're flexible. It says 15 to 45 minutes we can present. We can present in 5 minutes. A lot of times we're just part of a real brief meeting, and we'll just come in and give a real high-level overview in 5-10 minutes. Time seems to be really important in a lot of settings, so we understand that. And if you have more time, then we can, of course, go into greater depth. Second, what you'll see is what's called a learning station. Because if you can look on the second picture over on the slide that you're currently looking at, you can see one of our coordinators at a learning station. And basically what you see is a tabletop display where we have some information and handouts available, and we kind of just talk to people. We'll set up maybe at benefits fairs, or we can just set up in a break room and be there for a couple of hours and invite people to come in whenever they get a chance to gather information. They can stay for a minute. If they don't have a lot of time, they can stay for 5 or 10 minutes, ask questions. We just try to answer anybody's particular question that day on the topic that we're talking about. Third is coupon, which I think a good example of that would be maybe in a situation where there's a 24-hour facility, and obviously we can't come at 2 in the morning to present a program. So we have created what's called a coupon, and that's basically a summary handout that contains the highlights of this particular program, where you can just read the highlights and you can participate that way. Lastly, we have videos that are pretty brief. We realize that people are pretty stingy with their time, or they don't necessarily have a lot of time to go over this information at times. So we try to provide like 5-6 minute videos, and we put them on our website, and you can go onto the website and watch the summary video, and that's another way to participate. So in order to set up a program to have us come out to speak, all you need to do is contact your regional coordinator, and I'll cover that in 1 second. Other things we do other than come out and do programs is we produce I'd say quarterly Compass, which is a newsletter, and you can see here some of the things that we have on there, just highlights of some of the program topics that we're working on. We have success stories, which periodically we'll ask our agencies that are active to vote for anybody who's done a real or maybe who's done something special in the health and wellness arena, and who might just want to highlight what they've done and maybe inspire other people. We find that's pretty helpful when success stories come from coworkers. People tend to buy into that a little bit more. We also have recipes, support materials, and there's an option to receive the Compass newsletter electronically, or it can be mailed as well. One of the most successful things we've introduced several years ago is just what we call a weekly Wellnote. Typically, we send these out on a Monday morning, and they're just short electronic articles on a variety of health topics. And these aren't things that we actually write. We go out and kind of find current, pertinent topics, articles from good sources, vetted sources, WebMD, maybe Mayo Clinic. Not necessarily opinion, but factual, research-based information. And we once a year survey all of our agencies that we work with, and one of the most popular things that we find that they enjoy from us are these weekly Wellnotes. So that's something that you could start receiving if your agency is active with us. And we'd send those out to our contact person at the agency, and they would distribute those as they saw fit to maybe to every employee or to certain ones or however. I think every agency is a little bit different as to how they allow emails to be forwarded or shared. So that's just something that is up to the agency. But once again, pretty popular. So maybe your agency participates in CommonHealth currently. Maybe they don't. Everyone is eligible to participate, but we do need to have a contact person for for each agency that we work with. If your agency currently doesn't participate and you would like to, here are the contacts across the state. Like I said, there's 9 of us, and we kind of just broke this down by county, so you can go find your county and contact the associated coordinator via email. And you can see it's just a dhrm.virginia.gov email address here. So we have Suzanne works Southwest, Christina works West, Stanton, Highland counties. Sue Perry works the Roanoke area. Susan Lord, Charlottesville. Next slide is Cynthia works Eastern Shore. Mary Louise works Williamsburg, Fredericksburg, that area. I work Chesterfield, Petersburg. It's called South Central. Lunenburg, over to South Boston, that area. Amy works Northern Virginia, and Ryan works basically downtown, Greater Richmond area. Picture below Ryan's name there is just one of, you'll see us at one of our development meetings where we're just kind of working. We probably get together every 2 months and, like I said, create new program topics and work on challenges and kind of share ideas. So it brings us to, like I said, the current topic, which is metabolism makeover. What you're looking at is a PowerPoint presentation that we have for each program topic that we develop. So it's typically maybe 15 to 20 slides. It's available, like I said, on our website, and anyone can go kind of just go through the slides. Pretty easy way to get an overview of the topic. So what is metabolism? It's the body's process of using food for energy. And lots of different things affect metabolism. I think if I was to ask, if we were in a meeting and I was to ask you right now, what affects your metabolism, you might think it's age. As you get older, it slows down. I hear that a lot. Of course, the way you eat and how active you are. A couple things you really can't control, though, are your age. You can't control whether you're male or female. And the other things that you can control are the way you eat, how active you are, and your body composition, which is basically how much body fat you have. So what can you do and what can you control? You can control your movement. You can control your fuel consumption. This is kind of a car analogy here. And your maintenance is important too. Whether or not you're sleeping properly, getting proper rest, maintaining your body is important to your metabolism. There's actually, if you're not sleeping properly, there's a hormone that controls your hunger that kind of might actually increase your appetite. And on the converse side of that, if there's a hormone that controls how full you are, and you might have a decreased amount of that if you're not sleeping right. So sleep does have an important role in your metabolism. Probably the biggest thing that you can do to increase your metabolism is strength training. And that is because strength training is a way to preserve your muscle mass. As you get older, you probably agree that you tend to lose muscle mass, and that associates with a slower metabolism. So the only way to kind of counteract that is to exercise. And when I say exercise, I mean strength training, resistance training. You can do that a number of different ways. Obviously, the first thing that comes to mind probably is free weights or machines, but you can also use your own body weight. You can use resistance bands, lots of different ways to do it. Kind of beyond the scope of a short presentation to get into a lot of strength training information, but it's pretty simple to find an entry-level strength training program on the internet, and that's kind of what we'd recommend is if you're just kind of getting started, either kind of do a little research on the internet or contact the local fitness center and try to get some help, a program design through someone at the fitness center. So this applies a lot to people who, and a lot of us do, have desk-based jobs now where we drive into work, we go to our desk, we sit, and we sit all day. And then we wonder why maybe as the years come and go that we've started to gain excess weight. And a lot of it just comes down to the fact that we're just spending too much time sitting. Didn't used to be that way, but based on the jobs that a majority of us have now, we're just kind of stuck at a workstation, and we just don't have the ability to move around as much as we used to. There's other factors, of course, but at the end of the day, we really need to make an effort to sit less and stand more. If you're in a situation, I guess a good example would be at a call center where you're taking calls all day. Even if you have the opportunity to stand up for a minute or two, once every 30 minutes or once every 45 minutes, it would make a big difference, actually, in your health. So I would encourage folks that are in that situation to move as much as possible. And I know it's a challenge, but I think it's even more important in a situation like that to move and make an effort to move when you're not at work. So one of the things that we've come across, a kind of an interesting saying, is sitting is the new smoking, and that kind of gives you an idea of how important it is, or how dangerous it is to sit too much. So, of course, the way you eat has something to do with your metabolism. And a lot of times people want to lose weight, and they want to lose weight quickly, so they'll go on a fad diet, and that's really one of the worst things you can do, especially when you really maybe set yourself on a really rigid menu where you're only eating like a couple different kinds of foods. Obviously, you benefit from a wide variety of food based on the fact that you get nutrients and vitamins from a wide variety of foods. And when you only eat certain types of foods, you might be depriving yourself of that. And of course, a lot of people feel like when they go on a diet, there's maybe no need to exercise right then. Maybe they want to lose weight and then start exercising. Maybe they just don't obviously have any energy to exercise because they're eating so little. So fad diets typically might work short term, but in the long run, you'll end up probably back where you started, and maybe even worse. So we just kind of encourage folks to fuel up in balance and not get too restrictive and eliminate complete food groups. We've done, like I said, 30 years worth of programs, and obviously nutrition and how you eat continues to come up, and we always, every 2-3 years, we'll do a nutrition program. One of our most recent topics was a program that we called Focus on Fiber. And any program that we've done over the last 10 years, you can go onto their website and under a tab that says past programs, you can go access it and go through that PowerPoint and get all the information that we put together. So that was a good one, probably a couple of years ago that we did, and it just kind of lets you know that fiber is a really great thing to focus on if you're trying to lose weight. And most people don't have any idea how much fiber they're getting or how much they need. So we kind of covered that. while I'm on it. 25 grams for women, 38 for men. So if that number means nothing to you, then maybe go check out our program and kind of figure out, kind of see what we're talking about, how you can do that. My tip would be gotta get fiber in every time you eat. And you'll see a picture here of the fruits, vegetables. A typical apple, a medium apple might have 3 or 4 grams of fiber, just to kind of give you a reference point. A slice of white bread probably has no fiber. A slice of whole wheat bread might have 2 grams of fiber, just to kind of give you an idea. So we already said don't skip meals. If you don't plan what you're going to eat, and you just kind of eating as you go, you're probably not going to eat as well as if you would maybe prepare meals and bring them with you. That especially goes for lunch. Breakfast is a meal that's a lot of times just skipped. Once again, a lot of times folks trying to lose weight think that maybe they don't eat breakfast. That's going to end up being beneficial, but in the long run, actually, folks that have lost weight and kept it off, high percentage of them start their day every day with breakfast. It really, more than anything, I think, curbs your hunger and keeps you from being really hungry. It stabilizes your energy and blood sugar levels, so you think clearly, and it just kind of keeps you from overeating when you do eat. Sleep, once again, really important. We did a great program called Get Your Z's, and that's on our website as well. Let's see if we have some tips here. The environment's really important. So when you see the temperature and the lights off, darkness and quiet, that's called your sleeping environment. And really, if any of these things are messed up, if there's too much light coming in your room, if it's noisy, if the temperature's not right, then you'll be uncomfortable and you'll wake yourself up, or you'll just have trouble getting to sleep. So make sure that your sleep environment is right. And unfortunately, that means you can't watch TV, to fall asleep to TV. A lot of people like to do that, and that's kind of works against what we're saying here. So we're asking you to get in the driver's seat and move more, which includes strength training. Eat well. We talk about small, frequent meals with plenty of water. You need water to process the food that you're eating and for all of the chemical reactions that are going on inside your body. So if you aren't getting enough water and you're dehydrated, that slows your metabolism down as well. And sleep better, of course. We just finished talking about that. Make that a priority. So our website is here, commonhealth.virginia.gov, and like I said, old programs. We archive the weekly Wellnotes on there, so you can look at those. And there's resources for the agencies to look at if they want to put together their own health or wellness challenge. We have ideas on there for folks to look at there as well. We have a Facebook page, which we kind of keep pretty up to date, and you can go look at that there. And there is our boss, Ann, is the Employee Programs Director. And if you have any questions about CommonHealth that we didn't kind of go over today, you can contact her or just go to our website, and I think there's a wellness email box. And that is the end of our presentation.
Thank you, Craig. Are there any questions for Craig about the CommonHealth program? I will say that Vita is a participant, and several on my staff as well as myself have participated in several of the programs, including Metabolism Makeover, and it is especially working in an office environment, and it does make it difficult sometimes to maintain the metabolism or to maintain the energy, and especially as we grow older. So the tips, while sometimes viewed as common sense, are ones that I think we often need to be reminded of. Well, Craig, thank you very much for doing the presentation. Melissa, are you switching the presenter over, I take it?
I am.
Lynn?
Lynn, you're ready. I'll send it over to you.
I am here. I think I recall that when we tried this, I might have shown the wrong monitor. I have two monitors, so it might take me a minute just to make sure that I have the right one up for you guys.
I've had that problem many a time.
And Craig was so perfect to end right at 2:30. Goodness, no pressure as far as timing. All right, it says I'm now the presenter, and so I just need to see where to share the screen. Sorry. Here we go. And
it looks like it's coming. Yep, there it is. We do see it. So, Lynn, I turn it over to you to tell us about the Employee Assistance Program.
Well, thank you. What a great opportunity to present to this group. I don't do many webinars, so forgive me. And I'm used to having interaction, so please chime in if you have any questions. Craig was right. This is kind of unusual. Normally I either speak to state employees or I speak to local choice employees, and I rarely have the opportunity to speak to both at the same time. So, excuse me. But the program that I'm going to speak to has very similar benefits. It's not identical. So it should be applicable to everyone, thankfully. So how familiar are you guys with the Employee Assistance Program? A lot of people say, yeah, I've heard about it. I've heard about the counseling resources that are available. But an Employee Assistance Program is a lot more, actually. It's really, if you think that if there's anything that's going to keep you from being fully focused at work, things that might be going on in your personal life, then there's likely a resource available through the Employee Assistance Program to provide some sort of assistance or a referral source to try to provide some assistance for you. The other piece that I like to point out is it's entirely confidential. The reporting that I do for this account is done at such an aggregate level that I'm not able to report at a local agency or a local group level. For the Commonwealth of Virginia, I report at the secretariat level. And for the local choice, it's reported for all of the local choice groups, which I believe there's close to 350 now. So again, it's all reported up in aggregate, so there wouldn't be any risk of any information you shared with us being shared with anyone at your agency. Now, the benefits for the Employee Assistance Program are tied to health plan enrollment, and I believe Melissa made you guys aware of that in the introduction to this presentation. So for state employees, they have the option of the Anthem plans, which are COVACare, COVA HDHP. There's an Aetna plan called COVA Health Aware, and then in Northern Virginia, there's the Kaiser plan. Now, I'm going to speak to the Employee Assistance Program benefits that are through Anthem, through the COVACare and COVA HDHP plans, but you'll find similarities with the other EAPs. So many of the benefits that I'll speak to, they likely have something identical to the program. And accessing their benefits, I've provided that on this particular slide where you have the 800 numbers and the website information. For the local choice, similarly, we have Key Advantage and HDHP plans through the local choice for our local governments and schools. And Kaiser is also available in Northern Virginia, so that's their information there as well. And again, it's tied to health plan election. Now, even though the EAP is tied to health plan election, the benefits that I'm going to speak to you about today, with the exception of the medical benefits that I'll touch on briefly, are available to anyone in your household. It's for covered dependents and anyone in the household. So even if it's someone just staying with you for a couple of weeks, I pick on Uncle Bob. You know, if you've got an Uncle Bob who's down on his luck and sleeping on your sofa for a couple of weeks while he gets his life back in order, then Uncle Bob can actually call and use some of your EAP benefits and services because, again, it's available to anyone in the household. We have access 24 hours a day, 7 days a week, 365 days out of the year, and information available by phone or by web. And most of the benefits, are free. So counseling is typically the most recognized EAP benefit. And again, it's important that people are aware of this. It's free. There are 4 free visits per issue per plan year, and that's with licensed counselors who can help with a variety of different topics. Most of our requests are for family relationship type issues, stress, depression, and anxiety issues. Now, I included this prevalence information because there's such a stigma around getting help for mental health issues, and there shouldn't be. Mental health issues affect 1 in 5 of us. Again, 20% of us. That's actually the same prevalence as the common cold. So think about how many people that you were around that had a cold this year. I was one of them. So, again, it's a very prevalent condition. There's help out there, and the EAP is there to kind of make it easier for people to access care. One of the new things we added in the last 2 years was the ability to seek help using a video chat feature where you can actually use your smartphone or tablet or webcam to FaceTime with a counselor, and it's through Live Health Online. And so in order to kind of talk about the benefit, I like to show people more about Live Health Online, which kind of touches on the medical benefit, because people are still learning about this, which I find to be quite unfortunate. Live Health Online Medical was introduced about 3 or 4 years ago, actually, now. And on the screen, you can see that that's basically what it looks like. You can go to livehealthonline.com and sign up. You just start a registration, enter in your insurance information, and then you'll be ready to go. Whenever you need to use it, you can have, and also you want to download the app if you're going to use your smartphone. That's what I use, is my smartphone. Then once you have the app available, all I need to do is touch the app, do my thumbprint to log in, and everything is there and good to go. And then you have the choice here. On the medical side, you can see pictures of the providers that are available. Once you select a provider, you can see their ratings. Most of our providers are 5-star rated, just like Amazon. You can see where they went to school. You can learn more about what their background is and what they like to do, what their specialty is. They're all board-certified physicians. In fact, I did, though, see a nurse practitioner just a little bit ago when I went out there. Typically, they're board-certified physicians in internal medicine, emergency medicine, pediatrics. There's even a separate delineation of practices for providers that specialize in allergies for this time of year. I know I was just sneezing earlier today. And then providers that specialize in dealing with children. And so it's very easy to access, available 24 hours a day, 7 days a week. And the cost is either equal to your copayment or it may be waived. For state employees, it's actually being waived. That copayment's being waived starting on July 1st. So, again, something to think about. Medical providers can prescribe, and they would actually just get information on the pharmacy of your choice. I've actually used Live Health Online Medical myself. I used it for a sinus infection over Christmas a couple of years ago, and then more recently used it for an eye infection. My eye was red, and I needed eye drops, and it was like 6 o'clock at night, and I was like, oh, I should probably do something about this. And I was able to sit at my kitchen table, speak with a doctor, have him look at it, again, 10 minutes or less, and was able to pick up a prescription and be good to go. I've had colleagues actually call from the conference room here at work and then just run out at lunch and pick up their prescription and be good to go. It's so quick and so easy. Any questions about that while I'm here? No? Okay. Commonly treated conditions are here. Again, they're not going to treat conditions that might require an X-ray chronic back pain, things of that, and they're not able to prescribe medications that are controlled or easily abused medications. If you found yourself in a situation where you contacted LiveHealth Online and they're not able to treat your condition, then the copayment would be returned to you, and they would just, refer you to either an urgent care or to your physician, depending on the time of day and the situation. Now, I bring up the LiveHealth Online platform because from that platform, they've grown a behavioral health component, which I'm just thrilled about. I've been in the behavioral health field now for, 30 years. I hate to say it because then you know how old I am, but behavioral health, again, has always had somewhat of a stigma. There have been issues with access, concerns about confidentiality if you go to a therapist office and you live in a small town, who you might see, things of that nature. And this just opens up a whole wealth of privacy and access that didn't exist before in behavioral health. And so, again, I just think it's awesome. Commonly treated behavioral health conditions, stress, who doesn't have stress these days, depression, anxiety, grief, a number of various conditions. Starting July 1st, we actually will have psychiatrists available to you all. They treat ages 18 and up, and they can typically be available for an appointment within 14 days. They typically start with a 30 to 45-minute evaluation and then can prescribe medication and then have follow-up visits afterwards just for continuing medication monitoring. Counselors are available for ages 10 and up, and those that see patients that are less than 18 have an actual banner on their picture that says, sees age 10 and up, just so you know. Access to therapists can be same day. I just went out before our meeting today, and I think there were at least 5 therapists with appointments up until 10 and 11 o'clock tonight. The appointment times are typically from 7 in the morning until 11 in the evening, so a lot of availability. Prescriptions that our psychiatrists can prescribe are listed here. They're the common prescriptions used to treat depression and anxiety. You will find in the green box that there are prescriptions that our psychiatrists cannot prescribe, and those tend to be prescriptions that could be abused. And so they would want, to have those patients needing those types of medications seen more in a face-to-face type setting on a regular basis. Many of those, I believe, you actually need to have a paper prescription. You can't even e-prescribe those, I don't believe. So back to where we started. With the Employee Assistance Program, you can actually use your EAP visits, your 4 free visits per issue per year, using the video chat features available through LiveHealth Online. We would just ask that you give us a call at the EAP, and we can tell you how to access the practice and to give you a coupon code. So you could put that coupon code in to make sure you don't have to pay a co-payment for those services, and we'll kind of show you how you can set that up. It's really easy to do, though. I've actually personally used it myself. My husband and I went through the process of fostering to adopt last fall, and very excited and started off really strong and had a young 10-year-old in our house, and unfortunately, he wasn't quite ready for a family and started acting out, and it was very disruptive, and we were very sad that it kind of all fell apart. It's a lot of emotions, and I was like, hey, I talk about the stigma all the time. I talk about get help when you need it. Why don't I do this? And so I accessed LiveHealth Online EAP, and it couldn't have been any easier. I was able to choose, very carefully based on the pictures, based on what the therapist had written about themselves and their availability, and then I was easily able to get an appointment very quickly and see her. So again, I would encourage you, if that's something you've considered and think you might like that format, it's very easy, it's very convenient. You can do it, again, I was at home, which was really nice. I tell men especially that are very private and less likely to seek help, you can even do it in your parked car somewhere and no one would know. No one would be the wiser. So, again, opens up a lot of access. Now, so I've talked about the counseling service a lot, but I think that's important that people know. But I want to touch on these other benefits and services that are available through the EAP. Our second most common requested service is legal services. You can actually access an attorney either face-to-face or by phone for a 30-minute consultation for free. If you need an attorney going forward, there's a 25% discount on their hourly rates if you needed them. A couple of different situations that might come up are listed here. Most are family-related, custody issues, things of that nature, divorce, consultation, unfortunately. But we also have helped in landlord and tenant issues, people having a hard time getting their security deposit back if they've rented an apartment, or real estate consultations, things of that nature. What I really like to point out is what's on our website, because there are 100 or more different legal forms available to download for free on the website. There's also a link to one of our partners where you can use a code and complete a will online for free. There's advanced directive forms out there. A lot of people, when I'm doing my orientations, I'll actually ask, and people will raise their hands, which is more difficult to do in this format, but, to say how many people really feel like they have their estate, in order, or do they feel like they need to get some things done to prepare if something were to happen to them. And usually about half the crowd hasn't, gotten the will done, or doesn't have an advance directive, or hasn't really even, has thought about it but hasn't followed through to actually get things done. And so if you're not even sure what to do, there's a webinar on our website, on the EAP website, on estate planning and the documents that you should consider having. So you could even take the time to take a look at that with your loved ones and kind of make a game plan for getting some of these things done. But again, the EAP is here to help you with those types of things, whether you wanted to do it face-to-face with an attorney or whether or not you could do it online using our online tools. We also offer unlimited financial counseling with certified financial planners. This, again, is telephonic, but it's unlimited. If you wanted help with budgeting or planning for retirement, estate planning, again, any of those types of things, if you had some sort of financial disaster occur and you needed to kind of strategize how, you were going to make ends meet during a temporary thing, then that's what we're here for, to reach out on those types of situations. We also have financial calculators and things like that on our website as well. We also work with a partner to offer free identity monitoring and recovery services. If you were to have your identity stolen, then we have professionals that would actually work with you to kind of help guide you through the process of restoring your identity, the form completion, things of that nature. You'll note that the member that you would actually need to complete the police report. But other than that, our specialists could actually help you with, all the legwork of getting your identity back. But before even doing that, I would encourage you just to sign up for the free identity monitoring. I've done it, and I just get a monthly email, thankfully, that just says, okay, everything's good. Nothing really to be concerned about this month. So it's just nice to have peace of mind. The other pieces that the EAP can provide assistance in is help with finding child care. It could be anything from an in-home caregiver to a facility-based child care provider to summer camps, if you just wanted information on available summer camps. We also help with providing elder care referrals. When my mother-in-law passed away a couple of years ago, it was unexpected. She'd gone in the hospital for a routine surgery and had complications. And my father-in-law was in the early stages of Alzheimer's. And so when she passed, we were kind of in a lurch. We were like, what are we going to do with my father-in-law? And, how are we going to take care of him? He wasn't the easiest person to get along with, as it was, and we were very concerned about how her death would impact his ability to take care of himself and eat and those types of things. And so, again, and I talk about the EAP and benefits and services every day, but even I had a moment where I was like, what are we going to do? And then I was like, I'll call the EAP. And so I actually did and was able to speak with someone and tell them kind of where my father-in-law lived and what his current needs were, and then I could just hang up the phone. And I gave them my email information, and so within a couple of hours, they had emailed me information on available providers in the area. And we were particularly interested in the Alzheimer's Association and Meals on Wheels. And so it was just so nice to have someone else do that looking up, doing that legwork for me, that all I needed to do when I had a minute was kind of make those outbound calls, and I had the information I needed. Then they followed up with me a couple of days later just to say, hey, did you get everything you needed? Is there anything else? I've had colleagues actually use them when they had to place a loved one in a nursing home. They kind of walked them through, from finding available facilities to kind of what the process was, for placement and so forth. So, again, just it's there for those types of situations. One of our elder care partners is called Care Family, and we offer a discount if members wanted to use their services. They basically are Match.com for in-home caregiving. You basically would go out and set up a profile on Care Family and tell them what you're looking for your loved one, and they would give you information on available caregivers in that area who meet those requirements or what you're looking for, like if you're looking for someone who's going to be there, 24/7, or if you just want somebody for a couple of hours, 3 days a week, or overnight care, depending on what you're looking for, they could tell you available providers that have already been vetted, background checks. You get to see pictures. You get to see what they tell the world about themselves to kind of get a feel for the type of person they are. Then you can arrange an interview with them. And if you choose to hire them and work through Care Family, then you would actually pay Care Family. Care Family would pay the caregiver, and then they'd take care of all the taxes and all the other implications that come up when you hire someone for this type of service. Through the EAP, you get a discount on the premium membership that's available. I mentioned the website. You would find just a number of resources out on our website. You could spend days out there. Lots of articles. We have a News for You section where there's a new feature every month, a new topic that we have several articles around, and usually a monthly webinar that matches up with it. We also will put topical information out there if there's a tragedy. For example, the school shootings that have recently occurred. We'll typically put resources out there for members and people that might be impacted in those particular areas with links where they can get more information. So anytime something like a national disaster like that comes up, we'll put information out there. I mentioned the legal forms and the search features that are available, and I'm going to touch on skill builders here shortly. Are you guys hearing an echo, or is it just me? Sorry. It's okay?
It sounds okay.
Okay, good. Just my headset, I guess. Now, MyStrength is another partner we work with. It's called the Health Club for Your Mind. It's a separate website that you have access to for free as part of the EAP. On the MyStrength website, you can actually have tools that are, again, well-being type resources. There's modules on mindfulness and meditation. There's even computer-based therapy modules on a variety of topics, and those are listed. There's one on depression, one on anxiety, one on stress. A new one was added on sleep. We also have one on chronic pain as well. And those are just self-paced that you can use at your leisure whenever it's convenient for you. But again, lots of good videos, inspirational articles and quotes, things like that out there. I would encourage you to just sign up. Just by signing up, you'll get a weekly email from MyStrength that's about 2 paragraphs just to point out a particular feature that might be out on the website that you might be interested in. I just like it because I usually get it on Sunday afternoons, Monday mornings, right before I start my work week. So it's kind of a way to remind me to just kind of take a breath, that I got it, because I'm usually anxious as I start the week. I don't know if you guys are like me, but that's kind of, I get the Sunday night blues or whatever, the little anxiety about starting the week. Skill builders, we have online training on our website on a number of different topics, and again, they're self-paced trainings that you could take. Usually take about 15 to 20 minutes. There's one on time management, there's communication skills, just a variety of personal growth, professional growth topics for you. And you can even print off a certificate of completion if that's something that you wanted to share with your manager. We also have a blog where various people within our organization write articles and post links to external articles, just things that may help with mental health, well-being, things of that nature that are out there. And I also like to touch on our on-site resources that are available through the EAP, through the Employee Assistance Program, and this is available actually to anyone regardless of their health plan enrollment. But for our covered agencies, if you're a local choice agency or a Commonwealth of Virginia agency, you have access to on-site workshops. They can also be webinars, just for you guys if you wanted to keep that in mind for future trainings. Steve and Melissa, we do have about 135 to 140 different workshops that are available. They're typically an hour in length if you wanted to consider one of those for a future meeting. We also offer on-site counselors in the event of a worksite tragedy or the death of an employee, where we can have a counselor actually be present on site to meet with employees either as a group or one-on-one if they wanted to process their feelings. And that is the presentation. So I actually finished up a little bit early. Any questions? It's been so quiet.
I have a question. This is Michelle Surday. I'm in Prince William, and perhaps I missed it, but I saw where the EAP services are for 4 sessions. Is that a reduction from previous? Because I used it not too long ago, and I thought it was 7 sessions.
I'm not sure Prince William is one of our groups. Do you have coverage through the local choice?
I'm not sure who the coverage is through, honestly.
Yeah.
Just know we have access.
Yeah, it would be on your ID card. If it's Anthem, you may have a separate policy that has a different number of sessions. Different EAPs may have different sessions.
Okay, thank you.
Sure.
And this is Steve Marzoff again. I think that's a good point, that there are other programs out there, and this isn't the only one. So a lot of localities have some sort of an employee assistance program, whether it's through Anthem or something. So if it's not exactly the same program, talk to your human resources or benefits office and find out what it is you do have, because as I enjoy these presentations because I often forget of all the resources that are available to us and being acquired by the Commonwealth for its employees. And within the state government, we have 120,000 employees. So it's definitely to our employers' benefit to make sure that we're healthy, we're able to deal with the inevitable crises that come up in our lives, and work through those common everyday things like establishing a will or advance directive or those sorts of things. So these benefits are there for us to take advantage of, and we really need to be thinking about that, not only for ourselves but also for our families and our children and our parents and everyone else, because it is something that is valuable for us to work on. Are there any other questions for Lynn? Well, as I mentioned before, we did record this entire session, and we'll be making it available on our website. So if there's somebody that from your agency or that didn't get to see it and you'd like them to be able to see it, we'll have it available for you along with the PowerPoints on our website. Lynn and Craig, thank you so very much for taking time out of your day to do this for us. And as always, if anyone has any suggestions on other topic areas, again, doesn't have to be the technical stuff you normally think of from VITA of bits and bytes and megahertz and gigahertz or radio or GIS or 911. If it's important to all of you, it's important to us, and we want to make sure that we provide you information that's valuable to you and helps you get through your day, and helps you manage your agency and your center or your program better. So if there aren't any last questions, hearing none, we'll end the session today right at 3 o'clock. And thank you all very much for your time, and have a great rest of your day.